So self-myofascial release, big word for self-massage or trigger point therapy, deep tissue massage, okay? They're all different ways of saying you get into a muscle and you make it work better, okay? We could get all into the science, and maybe I will along the way, but essentially what we need to do that is either a really expensive massage therapist, which you can do, or you can buy a couple balls and a kettlebell to have right beside your bed whenever you need when you're experiencing pain. Obviously, this is what I recommend. You know, go get a massage every once in a while. I do, but I'm not going to spend $150 several times a week. So I'm going to review each tool as we go along and what they're going to be good for. But just briefly on the science piece of it, essentially what we're doing is, especially for the back, in this particular video, is working on how efficiently the core musculature is working. Okay, we went over the breath. Super important that we utilize those techniques in using these tools. Now, when we use these tools in that particular area that I mentioned, the anterior core, we're going to make sure those muscles are working properly by releasing them back to their normal length. When something gets tight, especially anterior core, from sitting, okay, if I'm seated, all of this is stuck. All of this is short right here. Every piece of my core, my hip flexors, psoas, iliacus, I got groin shortening, rectus abdominis, TVA, it's all getting junked up, tight and stuck together. So for those of you that are sitting at work, sitting in the car for long drives, it doesn't surprise me at all, and it shouldn't surprise you that your low back is hurting, because when you get stuck and tight here, you go and stand up, everything is stuck. I'm sure you've gone to go stand before and you're like, It's because all this is stuck and tight, and then you go and stand to extend your back, and it's pulling my back into hyperextension, and now I'm feeling that pinchiness back here. It's fucked, okay? So you have to release all this muscle, make sure it's all long and loose again, so that none of this is pinching and all painful back here. So to release those muscles, we're gonna kind of go top, this isn't the top, this is the bottom, go bottom up. I just like working that way. It kind of allows me to organize how things are working. I figure if our bodies are working from the ground up, that makes sense to me. So the first piece or first tool that we're gonna use can be one of two things. Now, this is all of these are great for kind of assessing how you feel and where you are in your process. If something isn't painful, you may need to use some other tool that gets in a little bit deeper to the tissue. What you're trying to find is tightness, and tightness is usually expressed by pain. So if something's really painful or even possibly ticklish, it means that area can be super tight. So for me, because I'm practiced, I've done this several times, I'm gonna use this bigger set of balls. I got this at Big Five. You can see the brand there. No affiliation. And I've mentioned these before. These are the Yoga Tune-Up Balls by Jill Miller, and I'll show you how to use each of them, okay? Essentially, we're trying to find a pair of balls that capture your rectus femoris really well. The rectus femoris is one of the hip flexors that goes down into the quad. So it's one of those muscles that gets really tight from sitting a lot, or if you're doing a lot of leg exercises such as squatting or lunging. So I'm going to use the double ball, and I'm going to capture that muscle. Okay, so I'm going to lay on top of the balls in that particular location. The nice one about this is that you can kind of relax in a way. I mean, you could lay it or hold yourself up on your elbows in like a plank position, or you can lay on your stomach. This actually creates a little bit more discomfort. Okay, so I would probably go back up onto my elbows just as far as my own pain and discomfort goes. Now from here, I'm gonna rest. I'm gonna completely relax as far as my leg goes, okay? So I mentioned utilizing the breath. You have to breathe, okay? Those deep breaths in and out of the nose. It's gonna allow our system, our musculature, our fascia to relax on top of the ball. Now, aside from that, we're gonna begin to do a little movement. I would say, I'm not gonna do this real time because you're trying to get through this video and then go do it on your own. I'm going to breathe and relax for about a minute with no movement. After a minute, for anywhere between 2 to 3 minutes, you're going to begin to do what's called the contract and relax method. Okay, so I'm going to show you that now. There's a variety of different ways to do it, but the first, think of contracting your quads. So what that looks like for me, you may or may not see it, hopefully you see it on the video, because you need to know how to do it, is you're going to contract the quad, straightening your leg, tightening it as much as you can on top of the balls, and then relaxing. Totally relaxed. And as you do that repeatedly over time, repeatedly over time, contract, straighten the leg, really flex it on top of the balls, and relax. Every time I do that, the balls sink deeper and deeper into the tissue. Now the actual function of that is quite literally your brain is relaxing the area. And when the brain relaxes the area, the fascia and the muscle underneath, it's allowing the tissue to get back to its normal length. And when the muscle and tissue gets back to its normal length, you're allowing every piece of your frame, your body, to move the way it's supposed to move. So my knee is going to track properly, and my hips are going to be in the correct range of motion. Okay, so I'm still doing that contract, relax. You're doing that for a minute, anywhere from a minute to 3 minutes. You could also play around with pulling that heel up and doing a little twisting. Now, if you're experiencing a lot of pain and discomfort, you're very likely not going to go through that full range, and that's okay, I forgive you, but it's something for you to work towards. Okay, and we're not really rolling up and down here. You're right in the middle of the quad and mostly just going up and down with the heel and doing the contract relax. Okay, so that's that piece. Now there's no difference between this and this, mechanically speaking, as far as doing the rolling technique. This is softer and smaller. So if you're a smaller person, and if you're a little bit tighter and you've never done this before, then you'll want to use softer and smaller balls. Okay? So that's rectus femoris. Now we're going to travel up the chain a little bit, and we're going to start to work on the hip flexor. So what's commonly referred to as the hip flexor is actually one of 4 hip flexors. It's called the TFL, tensor fascia lata, whatever. So it's in the front corner of the hip. The way I like to teach people how to find it is if you come to a kneeling position and you kind of grab the front corner of this meaty place of your hip, okay, that's where the ball goes. It can be a tricky place to find for some of you, so definitely try to get into this position and then poke around to find that muscle in the front of your hip. Now for this location, you can use a double ball or you can use a single ball, okay? Both big and small, so I could take these out if I need to. You can have a lacrosse ball, okay? Any ball size works. Really depends on your frame and how much pain you can tolerate in this particular position. So I'm going to use this big supernova here. Thank you, Dr. Kelly Starrett. I would not be living without this ball. So as I showed you, I was in this kneeling position, front corner of the hip. You're going to find that spot. The ball is going to go there. You're going to lay in this semi-oblique position. So I'm on like a side plank kind of position. I have my leg out in front, kind of holding some of my body weight here. You can bring the foot out like so, fully extended leg position out like this. You could be here, it really doesn't matter. Find a way to drape the front of the hip over the ball. Okay, so I'm holding with a hand. It's pretty tender for me today, okay? Now I'm not on the front of my hips. See, so a lot of people will lay square to the ground in their hips. I'm more open in my hips and my side is going into the ground, okay, rather than my face, okay? So I'm there. Now, just as before, and you're gonna get really comfortable with this method, we're gonna contract and relax on the ball after about a minute of just relaxing. So I'm breathing in my stomach, super relaxed. Then after a minute, I do my contract, relax, and that's gonna look different for this position. So what I'm thinking of is pushing my left leg, my bottom leg down into the ground. As I do that, I'll contract the hip flexor on top of the ball. So let's see what you see. My left leg is pushing down. Contracting, relaxing. Take a big breath in, contract, and relax. And I'm doing that for anywhere from 1 to 3 minutes. And because you like to see my backside, I'll do this side just so you can see from this position without breaking the mic machine thingy, whatever it is. So I'm in this oblique position on this side. As you go along with these techniques, with these self-massage techniques, you're going to start to recognize and feel exactly what each particular muscle feels like. Sometimes, and everybody's body is different, you'll have a nasty referral. So like if I'm in my hip flexor and it's really bad, sometimes I'll feel it referring down my IT band or maybe even in my calf. That's kind of how trigger points work. Now, if you're not tight and you're feeling pretty good that day, or you've made a lot of progress, or you're just not a tight person, you never experienced that pain, you won't feel anything. You might just feel a little bit of pressure. It might not be painful at all. There's nothing wrong with that either. So the more pain you feel, the more likely or not that you need it. So now, as you're going along with these, like if you come across one where you aren't experiencing any pain or discomfort, stick with it, okay? Because it can still be helpful. And as you do the contract relax method, sometimes the ball or the tool can get deeper and deeper into the tissue as you move along. Okay, so we got both hip flexors, we got both rectus femoris first, okay? As I said, it's 1 minute of relaxing and then 2 to 3 minutes of doing the contract relax in each of these positions. So we're adding up a fair amount in the timer here. But again, all of it's going to be useful, and you're going to be doing this over the course of this week. So then now the next location that we're going to start to work in is a pretty sensitive location. A lot of people don't like this one, but it kind of lends to why we need it because it's painful, it's uncomfortable, and that's exactly why we need it. So we're going to work on the iliacus and then up into the psoas, both of which kind of come together to create the ilio-psoas complex. So with a softball size ball, this is very important. It has to be a softball size ball. It won't work with a lacrosse ball. We're going to find the location in between our belly button, the front of your pelvis, and the bottom of your rib cage, right in the middle. I mean, very simply, if you just go 2 to 3 inches off to the side of your belly button, I could have said that too, but you don't want to be too much on the bone here or on the bone here, okay? So if I show you the ball, and the ball's fairly large, it's going to fit nicely in there for me, okay? And then eventually we may move down just a little bit. That's more iliacus down here on the inside of this hip bowl, more psoas up here. It's all the ilio-psoas complex kind of in this region. So once we find that location beside the belly button, I'm going to lay on the ball flat on the ground on my stomach. Okay? So I'm going to place the ball down right in that location that I described. The ball is sinking into my gut. So if you have to pee or poo, I'd highly recommend doing this before, because I actually do have to pee right now and it's less comfortable. Now you got a lot of things going on in your gut, right? You have a lot of organs in there. Small intestine, large intestine, the stomach you'll actually feel can be really uncomfortable on the left side of your body. You got some liver going on there. It's not dangerous, okay? So you may feel like, oh, this is a little dangerous and weird. I promise you're gonna be okay. I've had hundreds of people do this and be fine and actually feel better for it. So once I'm in that spot, you can see I'm in a semi-plank position. Really, I wanna get down and relax my chest. I actually drape the arm of the side that I'm on. Now, my body is fully relaxed, okay? Now, you're gonna probably not be able to do that right away. the relaxing portion. You're going to be flexing your core on top of the ball, and that's completely normal, obviously. That's why we're going to incorporate the breath. Now, out of all of the ones we've done so far, the breath here is the most important. The psoas attaches to the diaphragm. So if you do not breathe deeply into your stomach, which is your diaphragm, it will not engage the psoas and then help the psoas relax with the breath. So you have to follow that breathing process that we went over. That's why we did it first. So I'm breathing. You notice my back will rise. Full exhale. And you'll notice with every exhale, the ball sinks deeper and deeper into the gut because the core musculature is then relaxing. After a minute or so, you're going to do contract, relax again. So it's going to look like this. I'm going to flex my abs and push my right knee into the ground. I'm going to take a big breath in. Flexing. Relax. Sometimes you need to take a breath in between that. So breathe in again. Relaxing. And then repeating the process. Breathe in. Contract. Flex the core, push the knee down, and relax. Breathe out. Now from there we can do something else. We can do like we did on the rectus femoris, a little bit of heel pull, internal rotation, external rotation. Internal rotation and external rotation, considering that breath the entire time. Now with the psoas, sometimes you can feel the referral going down into the front of the femur. Like it feels more like it's in the hip, but this is actually kind of where the femur attaches to the pelvis. The psoas comes from our spine, it actually attaches to our spine deep within our gut and goes down along the spine through the iliopsoas complex and attaches to the top of the femur here. So you can feel that referral going down sometimes in the front of your hip. So again, 1 minute relaxing, 1 to 3 minutes thereafter where you're doing the contract relax method. Really quickly, I'm going to show you another version of that. When I had my really serious low back pain, I would do this next one literally every single night. It gave me some of the best relief that I ever had when I had my low back pain. So you have a kettlebell, or you don't have a kettlebell, in which case you don't do this, and I feel bad for you that you don't have one. Go buy one. They're not that expensive, and it's worth it for your pain. So we're going to lay on our back, and this is definitely more extreme. We're going to lay on our back, and we're going to find that location that I described to you earlier, where we're in between the belly button, the front of the pelvis, and the bottom of the ribs. This time we're pointing the kettlebell handle towards the pubic bone. Pubic bone is here. So I'm angling it towards that bone. The handle, that is. Like so. Still pushing on my bladder. Perfect. Okay. So if you're doing this one, again, you're going to breathe for a minute or so. You'll notice as I breathe in, my stomach will rise, and so will the kettlebell. And as I exhale, it'll sink deeper. Now I like this one because the weight of the kettlebell just gets in there perfectly, and I don't have to do much work other than hold it. After that minute of breathing, you're going to do this version of a contract relax, which is going to look like this. I'm going to exhale and slide my foot to full hip extension, knee extension. I'm exhaling as I do that. I could actually feel that referral going down into the front of my thigh here, top of my femur. And then I'm going to inhale, slide the foot back in. Belly is lifting with the breath, and I'm actually going to pull that knee into the kettlebell so I can feel the psoas contract under the kettlebell handle. And then relax. Exhale. Inhale back up. Slide in. Pull that knee in, contract, and relax. Now, obviously be careful. Don't go grab a 50-pound kettlebell, okay? I'm using a 26-pound kettlebell here for the way my psoas feel right now. That feels appropriate for me. So that's the psoas. I wouldn't recommend doing both of those the same day or the same night. You definitely want to split those apart. And I would definitely recommend, especially the psoas, before you go to sleep. So we have the hip flexors, anterior core. We've gone over several of them now. We have the rectus femoris. We have the hip flexor. We have the psoas that we've just done. And we're going to count the iliacus in there as well because the ball is basically gathering that at the same time. So in this week's programming, you're going to try to get each of these techniques within the same day, okay? Don't fret if you don't get all of them in that day. Definitely all of them within the week, like 100%. Don't miss out on these. The more you do of it every day, the quicker your pain is going to relieve and your back is going to become healthier. So what I'm recommending, because you just watched it, you're really fresh, go do it right now. Go lay on the ball. Or if you don't have a ball, you should have already gotten that, but go buy it now. Rush order that shit on Amazon Prime for the win. Get it, get on it, and probably let me know how it went for you.